so that we have 6 items. These 6 items in introduction we have to cover it. Number 1, greet the patient, introduce yourself, identify the patient, confirm the agenda. If you are speaking to a relative, ask him if he is next of kin or no. Number 6, if we are going to breaking bad news of patient, we have to ask, do you want anyone of your relative to attend this meeting or not? I will give an example now for this introduction. Assume that we have patient has chest pain, and already we did for request for him CT pulmonary angio, and we found that he has pulmonary embolism. And the patient written in the exam paper, you have to his son, Mr. Ahmed Ibrahim, he is waiting you to discuss the condition of his father, and assume that he has a consent from his father to discuss the condition with you. Let us now to tell the introduction. Good morning, Mr. Ahmed Ibrahim. I am Dr. Ahmed Maher, Senior House Officer in the Emergency Department. Nice to meet you. Nice to meet you, Doctor. Before starting the discussion about your father, I believe that you have a consent from your father to discuss his condition with me. I'm right? Yes, doctor, you are right. We are going today to discuss the result of imaging that request for your father. Is that okay for you? Yes, doctor. Do you want anyone of your family to attend this meeting with us? No, doctor, go on. This is a simple introduction. Good morning. I am Dr. Ahmed, Senior House Officer of Emergency Department. Greet the patient. I introduce myself. Are you Mr. Ahmed Ibrahim, the son of Mr. Ibrahim? Yes, doctor. Just identify your patient. Confirm the agenda. Before confirming the agenda, you have to ask him, I believe that you have a consent from your father to discuss the condition with me. That's right? Yes, doctor. Confirm the agenda. We are going to discuss the result of the imaging has been done for your father. Is that okay? Yes. It is breaking bad news. So that doctor, do you want anyone of your family to attend this meeting? This is introduction. يبقى introduction we have 6 items, we have to cover it. If no breaking bad news, خلاص, don't offer for him to any relative to attend the meeting with him. If you discuss the condition with patient, so that no need to tell him you have a consent or not, because you are discussing with the patient. This is introduction. Task. First, don't allow to the patient by his attitude to distract you about the protocol of communication in this part. Sometimes we face angry patient, and once you start the scenario, the patient shouting and he is angry, and he distract you about the pathway. Please don't allow for him to do that. Let the patient to speak and don't interrupt him. You have to listen carefully with non-verbal clue by hitting your head, just making a sound during the patient speak, like that. It is non-verbal clue and is listening for the patient and one of the communication skill. We have some questions to ask the patient about that. Once you finished your discussion, as usual, in your clinic, if the patient come to see the result of investigation, or relative come to you to ask about his father or his mother, what is the first question for him? How do you feel now? This is the first question. How do you feel now? You have to start your communication after introduction for the patient. Mr. Ali, how do you feel now? If you are discussing with the relative, please, could you tell me how is your father now? It is very important to make a rapport with the patient. It is a two-way of discussion, this communication. Let the patient to speak and reply to him in sympathy and empathy manner. If the patient told you, Doctor, I still feel pain, I have shortness of breath and lost weight, you have to reply, I am sorry for that. It is sympathy and empathy for the patient. You have to make this way in your discussion with the patient. Don't listen only. You have non-verbal clue and verbal clue. Don't interrupt, but it's just a matter of sympathy. First question, how do you feel now? Second question, how much you know about your illness? It is a very, very important question because the patient will tell him how much he is thinking. Patient has chest pain. When you told him, how do you feel now? He mentioned for you, I have pain. When you asked him how much you know about your illness, he told you that when I came to emergency room, I have this pain. But after that, he make a tracing for my heart, like it is ECG, but we are speaking now on medical term, tracing to my heart. And I feel better. I feel a little bit better. So that first question, how do you feel now? Second one, how much you know about your illness? Third one, do you know why we requested this investigation for you? It is very important to know what is inside the mind of the patient. Last one, what do you expect about the result of investigation? To know also what inside his mind. I expect that, doctor, it is a simple chest pain because I have coughed long time ago and travel abroad, so that maybe some bug could be bug inside the chest. He doesn't aware about pulmonary embolism at all, and the diagnosis was a pulmonary embolism. So now, before start the discussion, we have to ask the patient or relative, how do you feel now? Or how is your father feel now? How much you know about your illness? How much you know about your father's illness? Do you know why we requested this investigation for you? Or do you know why we requested this investigation for your father? What do you expect about this, the result of investigation? This is the 4 questions. Concern is the most important skill in the exam. Why? We have concern in station 2 in history, station 4 communication, and 2 cases in the station 5. Concern is about 16 marks. 16 marks. In each station, 4 marks. 4 marks in history, 4 in communication, 4 in the first case of clinical, first case in station 5, and second case in station 5, also 4 marks. If you lost 2 concern or 2 stations concern, you will not pass the exam. So concern is a most important skill. You have to manage it in the right way and to answer it clearly. Now, we mentioned introduction, main task, concern, then end of discussion. End of discussion, it is very, very important because a lot of candidates forget it. And during our lecture today, I mentioned that check understanding in the managed patient concern scale. It is written in the mark sheet. End of discussion. Number 1, you have to summarize the discussion and emphasize about important notes by saying to the patient, I will summarize now the important note in this discussion. Don't give more time for summary, just to highlight the important note. Don't repeat the discussion again. You are in this area, you have to we are going to tell the examiner about that we make summary, not more than this, so that you take only some few seconds, not more than 30 seconds. I am going to summarize for you most important issue today. You were admitted to the hospital by chest pain, and we make tracing of your heart and imaging in your lung. And I'm sorry to say to you, we found that blood clot inside the blood conduit of your lung. And as I told you, we'll admit you to the hospital and we'll give you medication. This medication will make thinning of the blood, and will admit you until we reach your blood thinning to the therapeutic range, and you will discharge after that and follow up in outpatient clinic regularly. This is the summary, not more than this. Second, we'll tell the patient, I appreciate we have covered a lot of issue today. Is there anything you would like from me to repeat it again or to go over again? The patient will reply, no, actually. Check understanding is very important. You will tell the patient, I hope our discussion is useful for you. Can you tell me how much you get information from me? The patient will tell you about the issue he want or issue he understood it during the discussion. So that it is very, very important to check understanding for the patient. Number 4, help. You have to offer help to the patient, like these websites and leaflet, brochure and videos about your condition, about pulmonary embolism. You have to read it, and if you have any question or any inquiries about your problem, this is my contact number. You can contact me at any time. It is a help. Again, this is a standard. Each case we have to do that. Each case. But in case of this, don't mention the patient, I will give you a website or brochure about this. It is not practical. Okay? Or number 4, help. Number 5, we'll tell the patient, I hope you have found our discussion useful to you. Do you have any further question or concern? It is one of the important question here. I hope you have found our discussion useful to you. Do you have any further question or concern? Maybe sometimes there's a hidden concern you didn't discuss, and the patient wait to repeat it again for him. So that it is very important to ask and repeat again for the patient. Do you have another concern? Then thank you all for the patient and shake hand. So, end of discussion, we have 6 items. Number 1, summarize. Number 2, ask the patient if he wants anything to repeat it for him again. Number 3, it is check understanding. Number 4, help. Number 5, do you have any other concern? Number 6, thanks and shake hands with the patient.